So today we're going to look at some of the symptoms that might be present during the late reproductive stage. So this is when your period is still coming quite regularly, but the hormones will have started to change, and there may be some symptoms from that. This is a very frustrating time for women because they often feel dismissed. They recognize their symptoms, but they feel dismissed by the people caring for them. And of course, many women just describe perimenopause, or peri, as the entire time leading up to the last period. However, by our medical definitions, perimenopause only starts when your period cycle length is out by more than 7 days. That's early perimenopause, and late perimenopause is when your cycle length has changed by 60 days, which really means skipped cycles. The late reproductive stage, which occurs just before perimenopause starts, is your period is generally quite regular, but maybe a little bit shorter. The cycle might be a little bit shorter. The period flow might be longer or shorter, and the flow might be heavier or lighter. So the research we're going to look at today is being performed by the Women Living Better organisation, which is a support and research group interested in perimenopause. And this research looks at the symptom experience difference between late reproductive stage and perimenopause transition, which includes both late and early perimenopause, the types of symptoms and how bothersome they are. There was 2,400 respondents between the age of 35 and 55, and they ended up with 945 in the late reproductive stage and 491 in the menopause transition, after excluding people who didn't apply for this, who didn't satisfy the criteria for the study. Now, it's important to understand this is an online survey, so it has limitations, and they looked at symptoms, the frequency of symptoms, the bothersome nature of symptoms. They calculated a burden and an interference. Now, when I mentioned limitations, because it was an online survey who was open to anyone, generally people who had symptoms responded to the survey and were interested in participating. So this information does not tell us how many women in late reproductive stage had symptoms. It just tells us the nature of symptoms looking at the late reproductive stage when compared to people with symptoms in the perimenopause transition. So we'll look at 3 groups of symptoms. I want to just describe this chart and the way they have demonstrated the data in this research. They have looked at the frequency of symptoms in the late reproductive stage on the left-hand side of that line, which occurs through the center or the middle of that grey shaded bar, and the menopause transition on the right-hand side. If the symptoms occurred equally, like mood swings, in late reproductive stage and menopause transition, then the bar wouldn't appear, it would be right on that line. There would be no difference. In the empty bars, what you can see is there's a difference, but they're empty because they're not statistically significant. That means that the difference wasn't important enough to be meaningful. The meaningful differences are shaded in the hatch, and you can see that sore breasts is far more frequent in the late reproductive stage, and forgetfulness, feeling low, hot flushes and sweats are more common in the menopause transition. Symptoms like irritability, mood swings, palpitations, sleep difficulties, brain fog or difficulty concentrating are all equally present in both late reproductive stage and perimenopause transition. Likewise, we look at the genitourinary symptoms. Interesting but not meaningful difference. More interest in sex in late reproductive stage. That's not very common. And then we have difficulties with orgasm, less interest in sex, pain with intercourse, vaginal dryness, and so forth. More common as women pass through the menopause transition. Muscle joint aches, dry skin, more common in the menopause transition, and basically all facial hair acne, fatigue and bloating similarly experienced. Now let's take a look at happens, what's happening to your hormones, if we can understand what's happening to your hormones during late reproductive stage, then we can better understand the symptoms and, even more importantly, know what treatment methods might be available. Now, when you're born with millions of eggs in tiny little follicles deep inside your ovary. And even before you're born, you're releasing a bunch to the edge of the ovary every month, which basically die off. At the time of puberty, there is your brain hormones turn on, and you get this stimulation of those follicles which are presenting every month to the edge of the ovary. They start to produce estrogen, and one becomes a dominant follicle and eventually ovulates. So not only do they produce estrogen, but they produce a hormone called inhibin B. So the LH surge from the brain causes ovulation each month. Then, of course, that follicle becomes what we call a corpus luteum. It continues to produce estrogen through the month, but it also produces progesterone, which is the hormone that features in the second half of the month. Now, as we're in our fertile years, we might get 10 to 20 follicles presented to the edge of each ovary every month. As our ovaries age, we start to have less follicles and eggs in reserve, and we have less presenting each month. If we have less follicles presenting to the edge of the ovary, and we only have maybe 4, 5, or 6 follicles, then we have less production of inhibin B. This is the first change that occurs with late reproductive stage. So a reduction in inhibin B causes the brain, notifies the brain that the ovaries need a little bit of help, and brain FSH elevates just slightly, but noticeable in research studies. The result of the elevation in FSH, because of the low inhibin B and the low number of follicles, is to send messages to those remaining follicles to produce lots more estrogen. So in actual fact, the estrogen in late reproductive stage can often be normal or elevated, and the FSH slightly elevated. This sometimes is experienced as a slightly shortened menstrual cycle, and ovulation typically still occurs. Now let's recap this because it's really important. Less follicles coming through to the edge, less inhibin B, causes an increase in FSH, which is not really measurable in your blood test, so it's limited to research studies. This causes more estrogen to be formed, and estrogen is typically normal or high. Luteal phase progesterone is normal. So at this point, your periods are mostly regular. They might be slightly shorter, and they may have started to change in their character. Most cycles will still have an ovulation. You can still fall pregnant. Now, why this is important to understand is that many women in late reproductive stage are looking for hormone solutions to their hormonal symptoms, but adding in even more estrogen is not going to be the solution. We won't go into too much depth in hormone treatments in this talk. We will save it for another talk. But effectively, the solutions that become very effective late perimenopause and in early menopause won't really work for you in late reproductive stage.